We are going live every week on Thursday at 4 p.m. and talking about everything in life regarding diabetes. Let's go. Hello again. This is Irina Strunina. This is our podcast, and we are talking here about diabetes. The reason why I decided to start this podcast is because so many people, after being diagnosed, they have so many questions and they have such a limited information about where they can find the answers for those questions. And that's why I am inviting people to our show who are healthcare professionals, social workers, people who are facing this challenge every day. They are helping others, they are helping others in different ways. So we are learning here on a podcast where you could find help. And also, on the very last Thursday of the month, I'm inviting people who live with diabetes to be our guests. We have special edition. It's called Warriors, and people are sharing their experiences about their life with diabetes, how they're managing, what their wins, what their discoveries. So, if you would like to be interviewed on this podcast, reach out and we will see how we could fit it in our schedule and interview you on, and you will be our guest. But today we have a very special guest. Some of you who are members of our group, Diabetes 101 for Beginners Facebook group, you probably already met with her. This is our nurse on call, Pam. She is answering your questions every other Tuesday that you can post uh, and see where she, when she goes online at 7 p.m., she answers the questions. You could have a conversation with her. And today I thought, hey, these are all texts. Let's talk live. Let's bring Pam here, and you could have a chance to actually see her, listen to her. She's a very nice person. I love the way how she is managing all the questions. So, Pam, welcome to our show. And please talk a little bit about yourself. Tell us who you are, where are you from, what are you doing?
Thanks, Irina. First of all, I want to say thank you. This is an honor to be on this podcast, and I love the opportunity to be able to share a little bit about myself. I love to know all the people in the group. I love our on-call nurse. I love those Tuesdays. It's just, I just love being able to answer questions. So a little bit about me. I've been an RN now for over 40 years. I just retired from hospital nursing this past Halloween. And I have a nurse advocacy business. Also, I am a telehealth nurse. And so
Uh-huh.
that's how we kind of made the connection here. But my background has been various, but it's been with adults, and it's been med surg, general education. Diabetes has been a huge part of my background as a nurse. So my background's been in acute care, which is the old term for that is medical surgical nurse. So that's just
Mm-hmm.
all, general, all your chronic conditions and things like that. Emergency room, I did emergency room nursing for several years, and for about 20 years was in home health and hospice. So that's where I really got an intimate opportunity to work with people and educate people. And respiratory illnesses and diabetes was really the top two things that we would educate, and we would work with people in their homes after being in the hospital or after a diagnosis. So diabetes is very close to my heart. I am a pre-diabetic. I am going to say that I have eaten my way to that predicament, and so I understand a lot of the frustrations when people are talking about in the Facebook group. So I'm in the trenches with you. I am bound and determined to not have to go on medicine. I've been able to lower my A1C from 6.2 down to 5.6. So I'm back in that normal range. And
Yes.
so it helps too when I understand, what people are asking and where they're in. So another real benefit of us as nurses in that group is that everybody likes, everybody's so overwhelmed. And Irina, like we talked about earlier, it's not always easy to get access to your provider. Sometimes it might take weeks or months to get in, or even to a diabetic educator. Or sometimes, depending on where you live in a rural area, you might not have access to a diabetic educator, maybe a dietitian. And so, what do people do? They go to Dr. Google. And
Yes.
they want to get help from Dr. Google. And there's a lot of great information out there. There's a lot of credible information out there. But one of the things that we can do as nurses is we have the training and we have the background to be able to sort through a lot of that stuff, know what's credible, what really might not be credible, so we can help guide you through that. One of the things that it's important to know is that we as nurses, we can't give medical diagnoses. We can't suggest medical treatment. We can't give our opinions on what medications to take or that. What we can do is provide education. But the good thing with us is to be able to run things by us. We can certainly advise you when we feel that this is something you need to take to your provider, and we can help you sort through those type of things that would be out of our realm as a registered nurse. And before we get any more into that, just as a person, so that you know me a little bit, I live in a very rural Amish community in southwest Wisconsin, near La Crosse or the Mississippi River. Our closest neighbors are Amish. We are 25 minutes to the closest Walmart,
Um,
50 minutes to the closest, what I call civilization. We live on uh, 115 acres, mostly wooded. My husband and I are avid outdoors people. We have quarter horses. We love to ride. We ride our horses on our property as well as other places. We used to game a lot. We used to do all those speed games with the horses, barrel racing and all this. But now that we're getting older, we've toned that down a bit. So now we just ride for pleasure. We just had a baby. We love to raise quarter horses as well. And so we just had a little guy born last summer. And so that's what we do for fun. I love crafts, crocheting, uh, and just helping people. And it just warms my heart. I love to serve. And so anything I could do to help is important to me. So that's a little bit about me outside of nursing. My partner and I, we have a nurse advocacy business as well, your Nurse Advocate Consulting. Her and I wrote a book
mhm.
on hospice. Uh, and
Yes.
that's also a passion of ours. And so lots of different things that we have our hands in. The last thing I'll mention about me, and that is that we are sharing a senior care summit 2024, and it's for adult children of aging parents or the aging parents. We are putting together, we ended up with 32 speakers on 34 topics related to senior care
Oh,
and
wow.
resources. And so we brought them all together. It's virtual. So we're going to release a couple of videos a day from March 1st to March 14th. Registration opened up today, but things like our resources are in 5 categories. Let's see, we have navigating the healthcare system, supporting caregivers and family dynamics, home and environment. We're going to talk about cybersecurity and um, safety requirements in your home, like if you're remodeling a bathroom, legal and financial. We're going to talk about elder abuse. We're going to have a financial planner as well as an estate planning attorney. So lots of things and that we want to share for resources for that. So that's kind of my love for the seniors, our adult, our aging adults has a real soft spot for me. But Irina, what else would you like me to talk about as far as the nurse on call, or what can we get into?
Well, this is you gave to people so much information right away. Let's unwrap it a
Okay.
little bit and break it down into pieces. So I would like to focus more on. Thank you for mentioning your event because a lot of people in our group are obviously diabetes often hits later in life, thankfully. Uh, so it's nice to know that you have such a event coming up that where people can learn about how they can help to their parents or how they can help to themselves if that's you by yourself and you need to protect yourself or prepare yourself for unfortunate events that may happen. So that's a good point that we I would like you to go later in the captions for this event for this show and maybe post the link to registration page
Sure.
so people could go ahead and register there.
Sure.
um, but what I wanted to actually stop a little bit, slow down on the fact that very often I do remember how it happened with us, with my family. My husband was diagnosed with type 2 diabetes, and unfortunately, he passed away from complications. But the complications hit on the 11th year after him being diagnosed.
Mhm.
And these were the nurses who finally started pointing out for us in the right direction, because for 11 years he was just visiting with his PCP, getting a refill on his medication, and that was it. I didn't go with him. I didn't know what is going on. He was capable young man who could go ahead and manage himself.
Mhm.
Uh, Very rarely he would share with me some information from their conversation, so I didn't have a clue where I could get education. It was before Google was Google,
Mhm.
before Facebook existed, before YouTube existed. So me as a caregiver it was very hard for me to find information and to learn about what he's going through. And I think the whole problem with diabetes now is the fact that we don't have enough information.
Mhm.
So what I was going to say, that these were nurses in a hospital where he happened to be, and they were like, "Did you take educational classes?" And I was, "What educational classes?" "Oh, there are educational diabetes education classes." And we had no idea. Then nurse said, "Do you have endocrinologist as your, who is looking at you?" Like, endocrinologist? Why? No. And she was like, "Hey, endocrinologist is the person, is the doctor who specializes in diabetes. And your case is such a severe already that you really need to have one." And she gave us a list of offices where we could make arrangements and recommended specific offices. So she said, "These are the other ones. I don't know what your insurance covers, but this one is definitely, I would recommend." And I send everybody who I know to this office.
Mhm.
So these were the nurses who finally gave us this information. Before that, for 11 years, not a single soul told us that he needs to go and visit with endocrinologist, go to diabetes education class. Uh, and it was great class. We got a lot of information, not only about uh, diabetes, but also social connections, what we need to know about the medication, the tools, the way how to structure your dinner. Who were carrying those education classes? Nurses. So these are the people, I think, the first responders uh, should be for everyone who got diagnosed, right? Um, my observation is that doctors are too busy. Nurses were the ones we had much better chances to talk with and to learn from. Is it correct?
Yes, and that's a great point, Irina. And nurses, a big part of our training, the reason why we have to know so much about so many things is our big role is education. Our role is to
Mhm.
teach our patients everything they need to know to manage their chronic illness, as well as what resources are out there and how to find them. I mean, that is a big part of what a nurse does. And so I think it's really, really important. And, I don't know how many years, it's been many, many years, but every year they come out in January where there's this list of, they rate the top rated healthcare professionals trusted, in the United States. And for years and years now, nurses have been in that number one spot, followed by, doctors and then other healthcare providers. And that's because nurses, they develop that relationship and that rapport that the doctor doesn't have time to do. My sister is a nurse practitioner, and she's shared with me over and over again. She was in a big clinic, and so they would always every year send out the patient satisfaction surveys. And she says year after year, the nurse practitioners will get higher ratings than the providers. And I've worked with some amazing doctors, so I don't want to put doctors down. I mean, I've worked with just some wonderful doctors that I trust my life with, but they often don't have the time to build that rapport. Like when you walk in a doctor's office, you're going to have the top three things you want to talk about, and you've got a couple of minutes, and there's no time for fluff or that. So the nurses, that's our role. So we make the time for that. So I think that's one of the reasons why nurses can be so helpful. And that's, with the nurse on call and with being able to reach us through the telehealth. I mean, it gives you an opportunity to be able to talk to the nurses and have some one-on-one time with us.
Yes, yes. And actually, this is actually brings us to the a little to next point that I wanted to talk about. We have in our group this event happening every Tuesday. It's called Telenurse. When we post during the day the announcement that today's nurse on call will be Pam or it will be Tina. We have a couple other people who are getting ready to become nurse on call, and we are inviting people to post their questions so you can go later and help people to find the solutions for what is bothering them. I have to explain a little bit about this whole story because SmartMove360 and Diabetes 101 for Beginners, we partnered up with Empower People, the organization. They are now our sponsors, to say. They are helping us to bring information, bring people to people. And the founder of this organization, he started this nursing service in a very strange way. He was helping doctors, and his question was, what else can I do for you? What else can I do for you? And all doctors were responding, oh, we are good, everything is okay. And then finally one doctor said, it would be so good if you can create a service with certified nurses, where real nurses who are right now serving people, helping people, could be this people on call. And if this will be the service that you could go ahead and see, okay, I like this nurse, she specializes in adult care, or I like this nurse because she's specializing at newborns care, or this nurse who is specializing in after surgery recovery. Whatever you like, you could have that nurse as your nurse on call. And that service actually got created, and that's how we thought that this is a great partnership we have. And Pam is a great, she was the first one out of the whole list of nurses that we have on a list of this Empower People, who said, yeah, I'll do that, I'll help. And this is one of the reasons I thought that Pam will be a great guest for our show, to talk a little bit about this service. So how does it work? So I will go to this link, I will pick you, and what happens next?
Well, I will get notified that there is someone that wants to talk to me. If I'm available now, I could grab. Otherwise, I can reach out back to them. I get a text, so I get notified right away that there is someone that wants to speak with me,
Mhm.
and then we would arrange a time. They would use my link because that connects me, so that knows that they're reaching me as the nurse that they want to speak to, and then we can have a conversation. And there is a charge for that. It's very nominal, so it's so many min how much by the minute, but it's an opportunity for in the Facebook group. It's good, but a lot of it we have to keep it general because we're trying to help a lot of people at one time. So by
Yes.
going through the telehealth and arranging for a conversation with me or whatever other nurse that you choose, that's an opportunity for us to get to know you a little bit better and to know your specific situation so that we can help you and meet your individual needs versus trying to be broad enough to help a lot of people at one time. So
Yeah, yes. Plus sometimes information is very personal and
yes,
you don't want to disclose it in front of the whole
yes.
Facebook, right?
Absolutely. And that is, I mean, and when we're in that Facebook group, even though you need to be invited and it's a private group, you
No,
it
it's
is
public
public.
group. Our Facebook
It
group
is
is
public. Well,
public.
then
Yes.
that's for protected health information. That's even more important. You know that um,
Yes.
that that people may not want to share those healthcare specifics where other people can see. So that's a great opportunity to have that kept private. So yeah,
Yes.
I that is a great thing to know because that the group is public, so anybody can just join. Is that correct?
Yes, this is the reason why we keep it private or
Mhm.
public, even though a lot of people are not very happy with that. There are
Okay.
several reasons. One, I believe that if you got this diagnosis, you don't have to be
Mhm.
ashamed of. This is in most cases, this is because of lack of
Mhm.
education, because we did not know, because we were not informed enough. So we bring information to everybody. Anyone could access this. You don't have to be a
Mhm.
member. If you would like to receive more consistent feed, then you probably will have to become a member of a group. But even just visitor, everybody can see the information. They could ask questions
Mhm.
from our nurses, or can ask our nurses different questions. They could ask our different other experts also their questions. They could just refer to group and learn from there. But also, when we are in this environment, again, the same way, you are a visitor to the group, but you know that on Tuesdays you could reach out, or you could grab the link because it's not publicized. The links are not yet available everywhere. It's not
Mhm.
911. But you could go to our group, grab the link, make a call, make arrangements, make a call. This is like long distance call. We are talking about, Pam mentioned this is the nominal charge. It is a nominal charge. It's like long distance call if you remember how it
Mhm.
was 20 years ago,
Mhm.
right? So this is not outrageous. And you don't have to drive to the office. You don't have to wait in line. You don't have to schedule an appointment and wait for 3 months. This is a direct connection to professionals who are there ready to help you and answer your questions. And you are in charge. You are making decisions. This will be this long call or this will be that long call, or maybe it's completely not related to diabetes, but I still would like to have the answer and I cannot go to the doctor for that. My insurance is not covering those kind of visits. So I just wanted for our people to have this information, to know that we have help available, and all you need to do just grab it. And I wouldn't even ask Pam. Here is the link how you can connect to her. You just go to this empowerpeople.care and select the nurse that you want to speak with. No, for Pam, this is direct link. There are, as I said, almost 30 nurses there of different specialties. So whoever you pick, you could connect with them and schedule a call with them.
You know,
And that,
no, I was going to say,
yes,
mention one more thing about in our world where insurance is unfortunately controlling a lot of healthcare. One of the other points I wanted to make, be able to use a telenurse service, is that we are not working when we're working with you. We are not working for a hospital, a clinic, or doctor. We're not working for your insurance company. We're there to support you. So we have no reason to give you any other information than what's best for you, because we don't have to worry about who we're working for or what their rules are or what they want to recommend. I mean, we are there just to support you, and it's our unbiased, professional help for you.
absolutely. Thank you. Thank you for bringing it up. I hope our listeners will be looking, searching for you, for other nurses for this service. We would like more people to know about it. The more people know about it, the better chances they have to get help in time when it's needed, but not when the schedule allows. Well, Pam, thank you very much. With that, I would like for us to actually go ahead and make my announcements that I have, because we need to, first of all, thank our sponsors for allowing us to run those kind of shows every week. And I'm talking about Mink Life Motivation, On Balance Entertainment, Life Based Solutions, and Empower People That Care. Um, with this information, I want everyone to know that in our Facebook group, Diabetes 101 for Beginners, on Mondays, we have this Motivational Mondays where our agent of change, Monica Henderson, goes live and has a short talk that will set you up to win the week. Right on Tuesdays, we have our nurse on call. We have Tina and we have Pam answering your questions and helping you to just to fix today's challenge. What is today that you can really quickly fix, or you could schedule a call and go ahead and connect with her. On Wednesdays, and every other Wednesday, we have our support group meetings that are going at 7 p.m. Eastern Standard Time for an hour. We meet in a group, we bring our experts. Sometimes we have several of them, sometimes we have one. And we talk about, again, like yesterday, we had a nice discussion about different issues that our members had. And we had another nurse and dietitian. She is diabetes coach, and she was answering those questions. On Thursdays, of course, we have our Diabetically Speaking with SmartMove360 podcast, and at 4 p.m. And on Fridays, we have Fitness Fridays with Trevor Brown. He is another representative of our other sponsor, Life Based Solution, and he is talking about different activities, physical activities, and nutrition, how you could combine those efforts, this information, this knowledge to help yourself to get better and move forward, improving your health. And the last thing that I need to talk about is our Diabetic Healthcare Expo. This is something that everyone needs to know. We don't have it every month. We have it every other month. So the last one we had in December. This one is coming up in February, and it will be on February 24th. We run 6 hours, and it is, I would call it, diabetes crash course, especially for newly diagnosed. We strongly recommend to log in. You don't have to register. You don't have to do any special preparation. You just go to our Facebook group, you go to featured post, and you look this featured pinned post and click on live and be there. You could ask questions. Our experts are talking about everything from diabetes, regarding the diabetes and how you manage it and how you um, helping others to learn and how you learn and what you need to be aware of. So mark your calendar, February 24th. Join us live in Facebook group Diabetes 101 for Beginners, and we'll see you there. With that, I wanted to say thank you, Pam, for joining us today. How do I bring back my, here it is, hide that, my design, here, hide, back, we're back. Pam, thank you very much for joining me today. Thank you very much for your explanations of some things that we sometimes just miss. And I hope we will see you more often in our events on Tuesdays and others. Please go and post information about your event, Caring for Seniors, with the dates and link to register, so people who interested can use that. And everyone, thank you very much for joining us. We will
Yes.
see you next
Thank you so
Thursday.
much for having me. It's been an honor. I love your community. I love what you're doing. It's such a wonderful thing. So keep up the good work.
Thank, thank you, Pam.
Bye
Thank
bye.
you. Bye bye.